Hello, everyone. It is 8 p.m. Eastern Time, and we are going to get started. Before we begin, a few reminders. A quick disclaimer. Please remember that the information presented tonight during this event is not intended to be a substitute for medical advice, and that you should always consult your physician whenever you need care, and never disregard professional medical advice or delay seeking it based on information presented during this event. Right now, I would like to invite Hector Garcia, Executive Vice President of Programs and Services, to share some opening remarks.
Thank you, Kathy, and hello and welcome, everyone. This is our forum number 28. So thank you for allowing us into your homes tonight. To our return attendees, welcome back. A lot of familiar faces tonight, which is, I'm getting to know a lot of people, which is great. I probably wouldn't have this many friends unless, it was just visiting with you. So, thank you for, letting us, share with you tonight and for 27 previous forums. So, that's exciting. It's, great news. And also, thank you for those who are new tonight. We are hoping that we're able to provide you with, the information that you need to contribute to, improving your quality of life. About 5 months ago, our team at IDF worked extremely hard and diligently to pivot all our programs into a virtual platform in order to continue to serve you and empower you through education, which it's our mission. Whether it be COVID-19 updates, wellness, school issues, or today's topic, IDF will continue to develop forums so that you remain well-informed and empowered to take charge of your health. Over the course of all these forums, we have evolved into actually inviting a national audience. So, tonight we have individuals for, over, 35 different states. California, it's kind of way up there in terms of participation, as well as other states. And the only state we're missing so far is Hawaii, and we'll continue to say this at every forum in case you have friends in Hawaii that would like to join us. Feel free to forward them our invite. We are more than grateful, for all your participation and everything, you contribute, to support IDF. And also, I want to say thank you to IDF staff, when they're the perfect combination to make, these forums, what they are today, and a great example of, what we can do when we work together towards, providing you with, everything, we can at this time. So, thank you if you're here for the first time, or if you are in attendance for your third or fourth of your 28th forum, like some of you, you are not alone. Our goal is to ensure that no matter who you are or where you are, IDF will always be here to serve you. I want to say special thanks to Dr. Dimitriades, which I hope that was a perfect pronunciation. I've been practicing for being here tonight. And she's donating her time to us tonight. And we feel privileged to have her, especially during these times when our medical professionals are giving so much of themselves to help keep us safe and safety. So, in the spirit of gratitude, which is kind of how I feel tonight when I look back and say, oh my God, it's, we might end up with, 40 forums this year and, 40 opportunities, to be able to support our community. It's just, just incredible. We have an amazing staff, like I said. We have an incredible community in all of you. We are grateful that we have the technology to be able to support you on this unprecedented times. And we have great sponsors. And it is because of our sponsors and their partnership and their contributions that we are able to bring you programs and services so that you are better informed. So this includes our core services leaders, CSL Behring, Grifols, and Takeda, our core services supporter, Octapharma, our core services sustainer, Horizon Therapeutics, our core services contributors, Lydian Biosciences, ADMA Biologics, our national sustainer, Accredo, our national patrons, Diplomat Specialty Infusion, Kedrion Biopharma, CBS Specialty, Quorum CBS Specialty Infusion Services, Biomedical Systems, and Cava Fusion. You will notice that many of our sponsors have plasma donation centers. So we encourage you to visit their website for more information on how you can help make a difference. And I believe Ashley or one of my colleagues will be sharing a link in this chat where you can find more information regarding plasma donations. So thank you for being here tonight. I know it's a little late for some and a little early for some others, but we're trying to be considerate of 3 different time zones, which is incredible. So thank you again, and now I would like to hand it back over to Kathy Antela, who will be your host for tonight's forum number 28.
Thank you, Hector. And as Hector alluded to, our forums are created to serve you. And as you can see from our mission, IDF is dedicated to fostering a community empowered by education. We want you to remember that IDF is committed to our community, serving you as a trusted resource through the use of technology and innovation, as you can see tonight. And we're here to give you the tools and information to become empowered and to offer you our compassion, understanding, and support to emphasize that you're not alone on your journey. We are all in this together every single step of the way. Now, I would like to invite Ron Johnson from CSL Behring for a quick word from our sponsor.
Hi, Kathy. Thank you so much. Hi, everyone. I'm Ron Johnson. I am the area manager in Los Angeles, California. I'm with CSL Behring. I cover Hizentra, our sub-Q IG for primary immunodeficiency. I just want to say thank you so much, Kathy. Thank you, Hector. I greatly appreciate it. Here at CSL, we're here, like you said, it's a community. We're here to help patients. So I look forward to seeing you guys in the breakouts. Thank you again.
Thank you, Ron. At this time, I would like to invite Jeff White from Grifols for a quick word from our sponsor.
Hey everyone, this is Jeff White with Grifols. I'm in the Oklahoma, Arkansas area, and I have responsibility for Gamunex and Zimbify. And I'm just honored to be here. This is my second one. I will have Laura Smith with me, our nurse educator. And I look forward to seeing you guys in the breakout sessions. So really look forward to it.
Thank you, Jeff. So at this time, the moment we've been waiting for is our presentation from our wonderful doctor tonight. He's going to speak to us about general care for individuals with primary immunodeficiency. So I would like to introduce our presenter, Dr. Dimitriades. Dr. Dimitriades serves as a clinical professor of pediatrics and as chief in the Division of Pediatric Allergy, Immunology, and Rheumatology at University of California, Davis Health. She is a strong advocate in helping patients become educated when it comes to their health care and treating each individual as a unique patient. So please join me in welcoming Dr. Dimitriades.
Thank you so much, and thank you everyone for being here. I truly appreciate the work that IDF has done in moving education forward, even in these very, very difficult times. Thank you to the sponsors, and thank you so much for these patients who are all taking their time to make differences in their own medical care by educating themselves. I think that's one of the strongest things that you can do for yourself as an immune disorder patient, is be involved in your own medical care, and this is the best way to do that. And so with that, I'll get started. I do have a couple of disclosures. I am on a scientific advisory board for Horizon. And I do speak on diagnosis of treatment and treatment of primary immune deficiency, although I'm not speaking about any of these treatment options today, so it shouldn't make a difference there. So when we talk about general care in primary immune deficiency, we have to first acknowledge that our patients have greater self-care needs. These are probably above and beyond what the general public needs to be concerned with in everyday care. But that being said, a lot of these things are fairly self-explanatory, and sometimes it's just a great idea to go through and make sure that you're addressing all these components of your self-care. It's important, as I just mentioned, to take charge of your medical and personal care, because that allows you to be an active participant, not only in your understanding of what's happening, but also in your treatment of what is happening. And then, of course, healthy habits, not difficult, but it is a big component that involves both commitment and consistency that will keep you on that straight and narrow path. We're going to review several general concepts, preventive hygiene, vaccination, primary care. We'll go through some nutrition. I won't go very, very deeply into it just in the interest of time, but there is more information on the IDF website that you can link to. We'll discuss exercise and sleep and stress. And of course, in this time period, everyone has a lot of the same questions in terms of infection control. So we'll go to the next slide and talk about general health measures. Seems fairly easy, but it's important to remember hand washing. I know we've been talking about hand washing a lot lately. This is something, however, that we were talking about well before the pandemic occurred. We know that we transmit a lot of diseases through hand touching and then putting it towards surfaces that are very susceptible. So using soap and water, washing your hands for 20 seconds or more is really important. In addition, between hand washing with soap and water, you can also use a hand sanitizer or antibacterial wipes. But I would recommend that that's not the primary way that you use hand hygiene. It's also important to remember to not touch your eyes and nose and mouth. And the reason we say that is because the surfaces on your eyes and nose and your mouth have a mucosal layer that is actually very susceptible to accepting infections. And so that is probably one of the easiest ways that we transmit from touching a surface or touching a person and then putting it into ourselves. Personal hygiene that we always have to discuss is regular bathing and showering. And yes, to the adolescents out there, with soap, please. And regular toothbrushing is also important, and dental care is also important. So making sure you have regular dental visits for cleanings and checkups can help prevent future issues from presenting themselves as major infections. This is kind of a busy slide, and I will say that we're going to talk about vaccination for a second, but I'm only really going to discuss current vaccination guidelines. That is, vaccines that are currently available in the United States. So I won't discuss any of the upcoming coronavirus vaccines, and I will recommend that you do discuss this vaccine with your personal provider when it comes around. Right now, what I can tell you is most patients with primary immune deficiency can receive the vaccines that are currently recommended. It's important that you follow up with your provider to find out which vaccines are safe for you. And in some cases, you may not need some vaccines depending on what type of therapy you're receiving. We have to recall, though, that even in patients who are receiving immune supplementation, so IVIG or subcutaneous IgG products, the current strain of flu is not contained in that product, as those products were created 12 to 18 months prior to this year's strain of flu. So it is important to consider flu vaccine even in patients who are receiving immune supplementation otherwise. There is caution that we give our patients, especially if they have any sort of immune disorders that involve their T cells, in terms of their live viral vaccines. Those are the measles and mumps vaccines and the varicella vaccines. But again, I would recommend that you discuss this with your primary provider, your immunologist, to see if you would qualify to get these types of vaccines. Most importantly for me is not only involving you in this care, but also involving your close contacts. It's important that everyone in your household or people you are in close contact with should also be immunized. That not only protects them, but that protects you as well. There are some vaccines that perhaps you might need to avoid those people for a period of time as they develop their own immune responses to the vaccine, and that should pass after a time, but those are vaccine dependent and you can talk to your provider about which ones those are. In general, I recommend that everyone around my patients gets their regular compulsory vaccines. So it seems like a no-brainer, but it's really important that everyone, in addition to an immunology doctor, who I'm sure you're all hooked in with, also has a primary care provider. The reason for this is because they need to be the coordinator of your medical care and to be your medical home. They can set you up for your general regular visits that you go to see them yearly for. They can also be easy access to you for your sick visits when you need to be evaluated. Obviously, they're going to be able to take care of immunizations. They also can do things that immunologists wouldn't necessarily do, like your preventive care in terms of making sure your cardiovascular health is good, making sure your gastrointestinal health is good, making sure you're going for regular follow-up for male and female reproductive health. If you feel like your primary care provider may be overwhelmed by some of these issues, you can often reach out to your insurance company and request a case manager that can help you direct some of this care. And in fact, there are several insurance companies that have a lot of resources that you can go to in order to help coordinate your care. Immuno-nutrition, okay. I feel like this is everyone's favorite topic when we have these discussions. So until recently, we thought the immune system was basically just building blocks. You just needed to get some nutrition, the nutrition part of the immune system was basically just using building blocks. That you needed this amount of nutrition to make these building blocks, and that's all that it mattered. But it turns out now in the last several years that we're realizing that this is a living being, and nutrition actually can affect how not only your immune system is made, but how it responds to things like infection or stress or cancer. And so we're starting to learn a lot more about how specific types of foods can play a role in how your immune system responds. The first one we'll talk about is macronutrients. So macronutrients are the basic building blocks. This is basically the protein, the carbs, the fat that we talk about. This helps make the baseline parts of your immune system. The second part is actually the micronutrients. So slightly more sophisticated, smaller molecules that include things like vitamins and minerals, which provide activation or inhibition signals. That's the go or stop signals of the immune system. Antioxidants are also some of these more fine, refined immune system components that include some of the vitamins and minerals and some coenzymes. The important thing about antioxidants is they are actually chemicals that counteract what we call reactive oxygen species. Those are the byproducts of immune functions, which are made during regular cell metabolism. If they build up too much, they can actually harm the cells that they're around. So antioxidants can be used basically to come in and dampen that response. In that same way, phytochemicals, that's the naturally appearing colors and flavors of plant-based foods, also can have anti-inflammatory effects. They can have anti-cancer effect and anti-UV light effects. When we discuss nutrition, we obviously are most worried about deficiencies. So when we talk about nutrient deficiencies, the biggest nutrient deficiencies that we see is something called protein energy malnutrition. Now, this is something that's much more common outside of the United States. We don't see it as often here. It tends to be associated with limited food access, chronic pain, dental or feeding issues. But in our population, who may also have, as you see near the bottom, chronic disease or chronic infections, this does become an issue. We know that when you have an infection, you're probably not eating as well, and therefore you are more at risk for protein energy malnutrition. On the other side are the micronutrients, and we know that iron, zinc, copper, selenium, and as I mentioned before, the vitamins can all be mapped to certain aspects of immune system functioning. Same can be said for omega-3 and omega-6 fatty acids. And I've put up some pictures here. These are all foods that contain different levels of these micronutrients. I'm not going to get into specifics just for the interest of time on this talk, but there are IDF links where you can look at a little bit more about nutrition specifically and what foods contain what types of micronutrients. Over here on the bottom right, you'll see the foods that contain antioxidants and phytochemicals. Those tend to be the things that you see in terms of plants that are very brightly colored. And so that's the thing that we're going for. You will notice on this slide, I don't have anything about supplements or powders, because the best way to get this type of nutrition is the most basic way, that is whole food eating. It's important to remember that because it not only allows for better absorption by the body, but it also comes with other secondary effects that are in the structure of the foods. For instance, things like fiber that can actually help keep you full for longer, and also can help with other digestive issues. Probiotics. So it turns out that sometimes living things inside of you are okay, and that would be probiotics. Those are little organisms that live inside the lining of your gut that actually help to digest foods appropriately. It is important for everyone to realize that not everybody is a candidate to take probiotics, so I would definitely check with your immunologist before you start any. There are many things that you can find on the market with names like lactobacillus, bifidobacteria. There have been really no studies proving that one is better than another, but what they have found is that the bigger variety of probiotics within a supplement or a food, the better it is. So we know that they can strengthen the gut barrier, they can enhance some immunity, but it's important to know that it's not a sometimes thing. So this has to be a regular thing that keeps kind of the species going within that area of the gut. For me, better than supplementation, which you can certainly find on the market, are actually eating foods with probiotics in them. And the way you find foods that have naturally occurring probiotics is look for foods that are fermented. So aged cheeses and yogurts are full of probiotics. You can use things like sauerkraut or kimchi as other ways to expand the probiotic diversity in your diet as well. I can't go by nutrition without having a brief discussion regarding all of these promoted foods. So we hear a lot of stuff on the news about garlic and turmeric and green tea and ginger, St. John's wort. The truth is, it's hard to really advocate for these because there really haven't been a lot of studies in these. In fact, of all these foods, only garlic has really been studied in animals regarding immune system effects. So it's very hard to say you should or shouldn't have these foods. In my estimation, I would say as long as these are used in appropriate amounts in conjunction with a nutritious diet, including foods that I had just mentioned previously, there's no reason why you shouldn't be using these foods as long as you have discussed it with your primary care physician or immunologist in order to ensure that the amount you're getting is not too much. So we can't talk about nutrition deficiency without discussing overnutrition as well. So getting too much nutrition actually can also be a problem. We know that fat cells, which they call adipocytes, actually can cause inflammation in the area where they are deposited. This problem is that you actually can induce immune system responses and even can cause autoimmunity stimulation because of this inflammation. We know it can also lead to poor wound healing and also susceptibility to several different types of infections. So there is another reason, let's say, to make sure that your nutrition is intact and also balanced. So, as I have said several times, you can see this is my soapbox, the best way to boost your immune system is to include foods that are naturally rich in nutrients and vitamins. Choose whole foods, less processed and with less refined sugars for better health and weight control. There have been studies actually looking very specifically at a whole food diet, meaning fresh foods, prepared foods, versus prepackaged foods, and comparing patients who did one diet using the same number of calories as the other, and found that the patients who had a whole food diet in general were fuller for much longer, did not need to snack as often, and felt that they were feeling more healthy overall when they had that sort of diet. Meanwhile, the patients who had prepackaged foods using the same calorie density felt hungry at the end of the day and did not feel like they had really promoted their own health as well as other patients. So it's something to think about. If you look on the choosemyplate.gov picture that I have over here on the right-hand side, you can see that the 3-plate split that we used to have, the 3-part split that we used to have in the plate, which was a third vegetables, a third grains, and a third protein, has really changed now. So this was a revamp that they did a few years ago. And you can tell on this plate that now half of it actually should contain your fruits and vegetables. So half of what you eat really should be fruits and vegetables. Only a quarter is grains and only a quarter is protein, and of course with dairy there. And so that's my favorite, statement, is to eat your colors, making sure that everything you eat has a lot of lively colors. And this isn't to say that you can't ever eat junk food or eat processed foods. I mean, goodness knows we love to have a little bit of comfort here and there. But as a general rule, if you have a nutrient-rich diet, it's much easier to incorporate other snack foods or sneak foods in without feeling like you're moving backwards in terms of your control of your immune system. Exercise. So moderate exercise has been linked to lower risk of upper respiratory infections. I wrote moderate on there because there were some studies that actually showed that athletes who did really significant exercise, these are elite Olympic athletes, may have had a higher risk of respiratory infections. But what they did find is that moderate exercise that regular people would normally do does actually have an effect in terms of infections. And we also know that it also allows for anti-inflammatory effects on the brain as well. It also releases endorphins, and so that helps too. Yoga stretching was studied in a healthy population, and they found that they decreased stress and they increased their IgA production in their saliva. And as we know, IgA is one of our frontline antibodies that can be present to fight off infections. So although it didn't prove it definitively that it helped, it is something that shows even just stretching as a daily practice was something that was helpful. Sleep. This is kind of a busy slide, so I'm sorry, but I really put this on here to show you. On the left side, it shows that your immune system can actually disturb your sleep by being too strongly activated. On the right side, your sleep actually, if you don't get enough of it, can disturb your immune system in the other way. So we know that these two things go hand in hand. Sleep is restorative for the immune system. Adequate sleep, that's 7 to 10 hours, depending on your age. Most adults can be more on the 7 to 8 side. Younger kids need to go up higher. Can actually improve infection outcomes and reduce your risk of future infections. And I'm sure many of you have felt that. If you're on the verge of getting sick and you have a really bad night's sleep, the next day you feel terrible. And it probably makes it worse because you never really got a chance to recover. Chronic sleep deficiency, we know, disturbs the immune balance because there is a loss of control of inflammation, and this can increase your risk of other diseases in addition to immune system issues. So you can have cardiovascular disease, you can have metabolic disease, you can have autoimmune diseases and other neurologic diseases as well. Stress. So we talk about stress as an overall concept, especially now during this time frame where everybody has really been pushed to some limits beyond where they ever thought they would be. But it turns out that stress not only affects your day-to-day life and your interpersonal relationships, but it also can affect your immune system. There are many things that work into causing stress. So genes, life experiences, your living and working environment, how much sleep you get, how much exercise you get, they all kind of come together to affect your stress levels. But we know that people under stress show lower vaccine responses. So clearly your immune system is catching whatever it is that you're selling there in terms of your stress, and it is responding in a lower way than would normally happen. We know that stress can worsen viral and bacterial infections. And then we know that it can slow wound healing as well. So clearly we're kind of building a story as to why stress affects our immune system, and that we should really be cognizant of how we can start reducing our stress. Infections. We know that low immune system can allow for infections, but we need to also remember that infections can actually cause more immune system issues. And the reason for that is that infections can also cause, and other reasons, but one of the reasons for that is that infections can also cause nutrient deficiencies. We know when you don't feel well, you're not going to eat as well, so you're going to have a reduced nutrient intake. You could actually lose important components through the GI system if you're having symptoms that involve your gastrointestinal system. And then we know that infection itself changes the breakdown pathway of some nutrients, so you're unable to absorb them as well as you would normally. I like this factoid. It's just interesting to note how much a change in your temperature, so 1% change in your body temperature, as if you had a fever, uses up your energy as if you had walked 28 miles. And this is something I'm sure you've noticed, maybe not so often in children who are clearly able to bounce back from fevers a lot better than adults are, but as an adult, having a fever really takes it out of you. And this is kind of an interesting factoid to say. If you do get an infection or you're dealing with it, you really have to be aware of how it takes a toll on your body. And no, it doesn't count for your weekly exercise. I'm sorry, you're just going to have to walk those 28 miles instead. Don't walk that far, but yeah. All right, preventing infection exposures. So obviously we are having a nationwide discussion about how to prevent infections nowadays. However, what I will say is the immune deficiency community has been doing this for a really long time. And all of these things are things that we have been talking about for a really long time. So I think using what you know during this time frame is very protective for all of you. In general, we talk about physical distancing. I like this picture down here of the umbrellas. I figured the umbrella's like 2 feet, her arm is like 2 feet, so they're about 8 feet apart. I think if we all just carried an umbrella, we could probably figure out how to stay away from each other a little bit better, right? We know that just being apart means you're not likely to touch each other. You're also not likely to spread things as you talk and yell or cough and sneeze. So that's something that we have known for a while. We also know that avoiding enclosed spaces for prolonged periods of time without a good ventilation system is kind of a no-no for our patients regardless. Masking is a big national debate right now, and I'm really just going to approach it on the how best to protect yourself angle. And then finally, hand hygiene, which I talked about a little before, but I'll come back to now. Masking is something that we have been using for decades for infection prevention. This is not a new concept. All of you know when you go into the hospital, if somebody is worried that they might get an infection, they actually use a mask. And we know that it works because it's truly a physical barrier to infection transmission. So it can't get through that space. But also importantly, as I mentioned earlier, it's a physical barrier to you self-contaminating basically. If your nose and mouth is covered, it's hard for you to accidentally touch that space and accidentally transmit any sort of infectious disease. We know that it has been shown to slow community transmission of many different types of diseases, not just COVID-19 right now or SARS-CoV-2 infection. But what I really like and what I think is super impactful for our community is that we're starting finally to have discussions on face mask use that is beyond just for the community and very much for our patients. That is, we are now finding that masks do more than protect others from transmission, they also protect us. So it turns out they've looked at several infection cohorts and found that when patients were wearing masks during their exposures, they were much more likely to have mild disease. That is, they had a lower viral exposure just because they were wearing that mask, and therefore what we call their, in quotes here, viral inoculum, that is how much virus they were actually exposed to, was much lower. And because of that, they had more mild disease, and in many cases were totally asymptomatic. So they were exposed, but asymptomatic. And for me, for our patients, if we're talking about using masking, that is one of the highlights that I can bring to them, in that even if you are exposed, in this case, it will be much lower risk because your viral exposure will be less. So for whatever other reasons we talk about masking, I think that's one of the best ones for our patients who probably have more risk when they are exposed. And finally, hand hygiene. I like this. Somebody put this up in our office recently. Wash your hands like you just chopped jalapenos and you need to put in your contacts. I just think that's a really funny way to remind people, wash them really, really well. Make sure you didn't just run them under the water, because it's not the same. And that will help everyone. We know that hand washing, they've been now releasing more studies about hand washing, and they are showing not just COVID changes, but also lower rate of seasonal viruses with increased hand washing. There was a study that came out recently. I'm not even sure if it's published yet officially, but it came out of some children's camps in Spain that showed there were less infections overall when kids wash their hands more than 5 times per day. So if you consider that basically your 3 meal times and 2 snack times, that's kind of covering all of your hand washing for that day, and you can decrease spread of any types of diseases that way. So as my final to go, of course, you are going to get ill at some point. We all do. What are we supposed to do in these cases? Well, first of all, your primary care provider is your go-to person who you can reach out to when you're ill. And in general, I would say getting an evaluation is a very good idea for our patients. I would follow their recommended treatment plan, especially based on what type of testing you need to do, what type of isolation you need to do. And this time frame is a little bit different than others, but overall, they can definitely get you started on evaluation. Always remember, rest and sleep is a big deal. So pushing through when you're ill is probably not the best thing. Although I'm a big proponent of exercise, you know, during this time frame when you're not feeling well, you can let that take a break or do something much less intensive in order to make sure that your body is recovering. Fluids really work. They actually have done some studies on chicken soup qualities and have shown that it does speed recovery. I put in here fluids are good, but maybe a little less caffeine and alcohol-based fluids and a lot more water and soup nutrient-based fluids would be helpful. And then as much as you can, as much as you're able to tolerate, I recommend maintaining a nutrition variety as much as possible. So lots of colors during that time frame, any vegetables you can get in there. Smoothies are great. You can do lots of fruits that way. In that it helps to maintain your building blocks and also maintain those extra nuances that will help you fight off this infection. And I think that's my last slide. Yes. So with that, I turn it back to you.
Thank you so much for your presentation, Dr. Dimitriades. And as a reminder to participants, you can continue to please submit your questions to IDF Forums in the chat box. And Dr. Dimitriades will answer as many questions as possible during the Q&A session. Now, before we continue though, I would like to invite Eric Pluckhorn from Octapharma for a quick word from our sponsor.
Hi, thanks, Kathy. I appreciate that. Happy to be here again supporting the IDF Forum. I'm joined tonight by Laurel Cherwin, who's one of our clinical nurse educators. And I'm glad to see there's more than 100 attendees tonight, despite it being the 28th forum, which is fantastic. And look forward to seeing everybody in the breakout rooms in a little bit. Thanks.
Thank you, Eric. Now I would like to invite Kara Talty from Soleo for a quick word from our sponsor.
Hi, thank you. My name's Kara. I work for Solio Health. We are a national provider of complex specialty pharmacy and infusion services. We offer IG infusions in the home and in any of our ambulatory infusion suites across the nation. It's a pleasure to sponsor this IDF Educational Forum, and we hope that you guys benefit from the information. We wish we could be there in person. Hopefully next year or the year after we'll be able to. Stay well. Thank you.
Thank you, Kara, and we look forward to hearing more from all of our sponsors today during the virtual exhibit hall. Okay, thank you for submitting your questions. At this time, Dr. Dimitriades will answer as many of them as possible. So meanwhile, continue to send those in. And here we go. Is it common for people with primary immunodeficiency to suffer from rigors?
I will not say that it is common and that I've heard it. I guess it depends on what the background is, what type of immune deficiency that is, and whether it is related to illness versus a baseline disorder. I can't say I've commonly heard it though, no.
I recently started self-infusions. Why does my temperature rise to about 100 degrees during or after the infusion, especially when I start by taking 2 extra strength Tylenol and 2 Benadryl?
So this is probably a question that could also be answered in the smaller group sessions too, but we do know that as you infuse immune globulin, you are getting a lot of factors that you currently may or may not have in your system. And so it is an appropriate response to suddenly being able to fight off things that you might not have been able to previously. So we assume that it is part of that initial infusion reactivity. I don't want to say reaction really, because it's not, it's a side effect, and that this should improve as you continue to complete these infusions.
Do patients with CVID develop antibodies to the flu vaccine?
That's a really tough question. So yes and no. It depends on the severity of your antibody response. Overall, we tell patients with CVID to get their flu vaccine in comparison to patients who are known to not make antibodies at all. So CVID patients do make some antibodies, but they're not necessarily protective enough. And our kind of our party line at this point is really that everyone should get the flu vaccine if they are able to get it. And trying to induce a response is better than not trying, really.
I had a flu vaccine and a pneumonia vaccine a few years ago and had a severe reaction, ending up in the hospital for a few days. I was told that because the nurse who administered both vaccines did not chart which arm received what vaccine, that I can no longer get either vaccine. Would it be safe to try again? You know, either of those vaccines? And also considering when the COVID vaccine comes available, I may not be able to get that either. So lots of questions, I guess, about, you know, where the person should go next.
Yeah, so it's hard for me to be able to counsel in terms of vaccine reactions without knowing the exact specifics. But I would say that this is something that needs to be addressed with the immunologist or allergist regarding the type of reaction and how they would feel. There are some ways that we can administer these vaccines again, and there's other ways that we can test for whether we can administer them again. So I would probably address this with them first before you go back to get them.
I heard that probiotic supplements can be more harmful than beneficial. Is this true?
I have not been under the general impression that they are harmful. However, I did mention that there are some forms of immune deficiency where you should not get probiotics because they can actually allow for growing of bacteria that you would not want. So for that reason, I would discuss it with your immunologist prior to introducing those probiotics. Every case is a little bit different, so it's hard to speak to the generalizability of it.
Can sleep needs vary from day to day when you have PI, depending on activity from the day before? I feel more tired a day or two after higher activity. Is that odd or is that normal?
I would think that that was pretty, I don't want to say normal, but expected. Let's say expected. There are certainly sleep needs that increase based on your usage. One of the things that we talk about for sleep is just maintaining a consistent sleep pattern. So that is, your sleep hygiene should include an activity that kind of slows you down at night rather than doing something that would make you more activated. It includes a routine that you do every single night, and then it includes trying to go to sleep at the same time every night. That, of course, can change based on what you've done for the day. I'm not sure that that's necessarily specific to PI. I think there's many disorders that have that same issue, and so you should be a little bit flexible in terms of that. But overall, trying to make sure you maintain consistency can help with your ebbs and flows of sleep patterns.
I'm not clear on what a case manager can do to help me. How would a case manager benefit those of us in the PI community?
Case managers are very helpful when you are seeing multiple providers, and they can help sort of keep you on track for follow-up if you feel like your primary care provider is not able to keep a consistent medical home. So they will check in with you. They can sometimes even attend visits with you, depending on where they are. I'm sure now things have changed a little bit, that we're doing a lot more virtual visits. They can help advocate for you when it comes to getting treatments. So there are many different ways you can utilize the case managers within that insurance system. And, you know, it's in their best interest to make sure that you stay healthy, right? So it is a good idea to try and reach out and find the resources that they can offer you to maintain your health and be able to not be admitted to the hospital and not be getting treatments that you wouldn't necessarily need otherwise.
Can long-term eating disorders cause CVID? I'm in recovery now, but had anorexia for over 30 years. Could this history have contributed to me being diagnosed with CVID?
So worldwide, the #1 cause for immune deficiency is actually nutrition. And mostly that tends to be the protein energy malnutrition that I described early on. We know that nutrient deficiencies can definitely affect immune functioning. However, once those are resolved, they do not tend to stay. So once you are back into a nutrient efficient system, you should not continue to have immune issues. I would guess that it was probably two things that were unrelated, but it's possible that the stress to your system may have connected these things in some way.
Does a 1-degree change in a lowered body temperature have the same effect as a 1-degree change of a fever? For example, if your normal temperature is 96 to 97 degrees, does this use up the same amount of energy?
That's a really good question. The temperature change was not based on someone having a fever. So I would guess, you know, they were just trying to say if you live at a certain range and then you're above that range for a period of time, that you would be using energy. The difference there is probably that your immune system is not as activated without a reason to have a fever. So for instance, if you happen to be overheated because you've been sitting outside, I don't believe that that would be the same issue as if you are fighting off something and your immune system is ramping up and therefore your temperature went up.
I know it's very important to eat clean. I've always been told that raw is better. My problem is that I am not tolerant to many fruit and vegetables in the raw form. For example, raspberries in the raw form give me severe stomach pain that will last for hours. My spine or back area will also start to hurt. In addition, my mouth gets extremely itchy. This is something that I really struggle with. At times the reactions are mild, other times they're severe. What is your suggestion for someone like me to eat fruits and vegetables?
So we talk about the raw form because the least manipulated forms are usually the ones that contain the most amount of these antioxidants and phytochemicals. That being said, I don't, as long as you're not overcooking something to where it changes the color drastically, I don't think that you're losing too much in terms of the benefits for your nutrition. And for me, I say we need to go to where we can be. We can do what we can do, and therefore I would try and structure it in a way that's enjoyable. Certainly you don't want anything painful or uncomfortable, and you can lightly cook things without overcooking them and still retain some of the nutrient properties there too.
Fatigue is prevalent in primary immunodeficiency and autoimmune disease. You indicated that too strong or too long immune activation could disturb your sleep and contribute to fatigue. Please expound on this and what can we do to improve our sleep?
Yeah, these are good questions. So there's not really much to say other than we know that when you have immune activation, that it allows for cytokines to be released that disrupt your normal sleep signals. And so it is very hard for us to backtrack on that without talking about treating the actual underlying disorder itself. In general, the issues with fatigue, I wish I could be more, topic oriented on that, but there's so many things that really come into dealing with why you're fatigued that all we can really talk about is making a structure around your sleep that will benefit you the most in terms of consistency. So as I mentioned, sleep hygiene is important. Exercise can be important for all of these issues, for reducing the inflammation as well as helping you sleep better for other reasons. Diet can help all these things. So it's not really I wish I could push this button and I could solve that issue, because a lot of these things overlap with each other. And therefore, there's really not one way to say, okay, if you do this, we'll certainly see a difference in terms of how well you're sleeping or how fatigued you are. It really is just making your network of all of these ways to support your system and doing it all at once in a way that, helps you move forward, basically.
Can you discuss life expectancy with a primary immunodeficiency?
I cannot. That is an extremely varied question, and every immune deficiency is a little bit different. I'm not sure we have a ton of research on that to begin with, but also things have changed drastically since treatments have changed. So a lot of the early research that talked about life expectancy was based on not really getting treatments. And now the horizon has expanded so much in terms of how to treat daily life, how to treat monthly life, how to treat long-term life, that it's very hard to say, exactly which immune deficiency would have what type of life expectancy. It's longer than it used to be, I'll say that, but I don't think we have really numbers that give you ranges like that now.
Can the IVIG meds cause stomach problems? I have begun having irritable bowel syndrome and a slow digestive process since starting infusions.
I am sure there are some side effects that can be associated with this. I would say I would probably direct you towards the product that you're using and talking to the representative for that product. Sometimes you can move things around and find results that are better with one product versus another. Overall, I can't say that we get a lot of GI system changes based on starting immune globulin infusions.
I'm on steroids and they make sleep difficult. Do you have any suggestions?
Just the same as before, really. All the medications can affect sleep in some ways. So just really setting yourself up for success with your sleep hygiene is probably the best way to address that. You can also talk to your physician about your steroid dosing and how you're giving it, and seeing if you can do it in ways that might be more helpful for you for your sleep.
What do you think about homeopathic immune support like Engastol?
I am not familiar with that product. In general, homeopathic medicine has certainly been a bigger component of our patients' care. And there are some products that you can review on several of the allergy immunology academy and college websites to see what things they list there in terms of efficacy. I will just say that anything that you do, you should review with your immunologist and give them a chance to research some of these things, because they're clearly not things that we have in the mainstream immunology treatment regimen. So we'll be happy to work with our patients and discuss what's happening, as long as it's safe and we're not worried that it is detrimental to your immune system, kind of like the other nutritional supplements that I mentioned. We would be happy to continue something like that in part of your care.
Could IVIG provide a false positive autoantibody test?
Yes. So IVIG has lots of antibodies in it. Antibodies that protect you from things, but also antibodies that are kind of non-specific. And so you can have some forms of antibodies, for instance, thyroid antibodies that are very common in the population, probably also come through in immune globulin infusions, and therefore you could have a false positive test.
Is the shingles vaccine safe for individuals with PI?
Again, this is one that I'm going to direct you to your immunologist for. There are probably some patients who should not receive this vaccine and others who should.
Are individuals with PI more likely to be injured by a vaccination, or would it depend on your type of PI? I'm somebody who's had an acute vaccination injury.
I have not been under the impression that we're more likely to have vaccine injury, if you mean localized reactivity in that sense. We are more concerned, I have not been under the impression that it's in more than the general population. Adverse vaccine reactions happen 1 in a million in general in the world. But with immune deficiency, we're much more concerned about accidentally getting a vaccine that your body cannot build immunity to, and instead gets the actual infection that we were trying to prevent you from getting. So that's more of our concern, which is why it is very PI disease related and dependent and different for each person, basically, based on their specific immune system. You can't even really say, you know, all the umbrella terms that fall under CVID can all get vaccination, because maybe some of them can't for some specific vaccines. So it is really important that this is an individualized discussion with your immunologist.
I'm 70 years old and have been newly diagnosed with CVID. Is there any possibility that my lab test antibodies will get better?
Ooh, that's an interesting question. It kind of depends on what your underlying diagnosis is, what the immune profile is, I should say. at the point where you're diagnosed at this age, if it's not due to other secondary issues, the likelihood is that it will remain at this point. Yes.
Is there a shortage of plasma for our infusions?
I'm going to have to allow the breakout sessions to address this. It is not my impression that there is. However, it is my impression that everyone is getting on board, including IDF, to prevent this from happening. And so we're being very proactive in terms of getting people to come in and donate. So asking friends and family to come in and donate this is a great time to do that, because we don't know what the supply is going to be like. I think all the companies have really gotten together and asked for everyone to come in and be helpful and make sure that we've boosted our supply. It's never a bad thing to have more.
Can the probiotics I've been taking be the reason for small intestinal bacterial overgrowth?
That's a very hard question. It would be very hard for us to tell specifically, because probiotics are not necessarily the bacteria themselves, but they are also partially things that feed the bacteria that are involved in these. Sometimes there's something called prebiotics as well. If you are growing a specific organism that is linked to one of your probiotics, I might question it more, but that would be a really hard connection to make overall. And if that is the case, you can stop the probiotic and that should resolve once those are no longer being supplemented. So if that hasn't changed anything, I don't know that I could necessarily link it.
How common is inflammation with individuals diagnosed with PI, for example, rheumatoid arthritis?
So again, depending on the type of immune deficiency that you have, there are varying risks for developing autoimmune disease. For instance, CVID has a higher risk of developing autoimmunity. And it can include things like rheumatoid arthritis. It can include GI disease. It can also include some low anemia diseases, some low blood diseases. In that realm. And then there are other forms of immune deficiencies that do not have as high a risk of those same conditions. It kind of really depends on the background primary immune deficiency.
Should getting an infusion be something to be scared and worried about?
I'm guessing this is asking about going in for your regular immune globulin infusions. I would say for my experience, our healthcare systems have really done a great job of ensuring that patients can come in and are not exposed to anything while they are here. And overall, I will say, at least in our area, I can speak to that, is that our infection rate is not from anyone getting infections within the hospital, right? It's mostly from people coming in from the outside, having already had infections, and then, they're there. So I tell my patients at this moment, we are so hyper aware of all of this that everybody's getting screened, everyone's wearing masks, everyone's wearing goggles and eye guards and all this stuff. So this is the opportune moment. This may be the safest time for you to be around, because everyone is so aware of touching and spreading and things like that, that I think you're probably safer now than you were before.
Since sleep and immune function are related, could decades of unrecognized sleep apnea be a root cause of CVID?
I can't answer that. I would think that just decades of unrecognized sleep apnea would affect your system in general, would affect a lot of your daily life activities, but it would be very hard to link it to a specific type of immune deficiency. And the rate of sleep apnea in the general population is much, much higher than the rate of CVID, for instance. So it would be very hard to say that those were specifically linked.
Is it normal for a person with PI to randomly run a fever but not be sick?
I'm not sure I can answer that really. No, probably not. But I can't say that it necessarily means something specific. I would probably just address that with your physician and have them track it as it occurs, so you can get a little more information of what's happening around it. Maybe you are sick and you just, you're not manifesting it in that same way. So,
do you have any suggestions for resources to help with long-term care planning for a person with PI?
Gosh, the entirety of the IDF website, maybe. That's probably the best place to start. There's not, I can't say, I mean, long-term care in terms of how you age and how you deal with immune deficiency as you get older, if I'm understanding the question right, is probably really based on a lot of the knowledge that our patient care advocates already have in terms of resources. I would really look at the IDF website because I feel like they address a lot of these issues starting from when you're younger and moving older, and so kind of it can help you make a scaffolding for future planning.
How much riskier is IVIG than a subcutaneous infusion?
Riskier in terms of what, I guess, is the
Probably
question.
reactions.
So IVIG is a little different because it is not different, but it's the IVIG and sub-QIG obviously are different from each other because of the form that it's going in. With IVIG, you get a larger amount all at once, and then you slowly wean down your level over the few weeks before you get your next infusion. With subcutaneous, you achieve a steady state that kind of goes up and down, but only minimally after you get to your proper dosing. Each one of those forms has different benefits, and it certainly is a patient preference in many cases. In some cases, physicians would advocate one over the other based on the properties of what you're giving or what you're treating or your underlying conditions. So I wouldn't say that they're different from each other in terms of inherent risk, but I would say that everybody needs to sit down and have a discussion about which best suits them. Once again, individualized for their specific primary immune deficiency and also their other underlying conditions, if they have any, before they decide which one to use or if they feel like transitioning.
In terms of getting a flu shot, is there a best time to get one in relation to the time that we also get our infusion?
That's a good question. In general, we talk about, there are some vaccines that we try not to give in close proximity to infusions, but they tend to be the live viral vaccines that can actually have a subdued response, a lower response if given in close proximity to your infusions. It's not really the case with flu. As far as I know, I've not heard that there's any specifics in terms of before an infusion, after an infusion. As long as your body is making an immune response, I think that's the most important thing.
Let's see. Oh, back to the question about IVIG versus subcutaneous infusions. With riskier in terms of side effects like meningitis. So between IVIG and sub-Q, what is the chance of having meningitis?
Okay, thank you for the clarification. So in general, the IVIG does have a higher risk to have what is aseptic meningitis. So it's not a bacterial meningitis, it's not a viral meningitis, it is just a meningitis that is an irritation. And therefore you get usually headaches. We do see that happen more frequently with IV infusion versus subcutaneous infusions. And that really is probably because of one of the properties that we're using for IVIG, which is that high dose that you're getting all at one time, and then it kind of, the level comes down in your blood. So that high dose is probably impacting that side effect. In general, when you don't want somebody to get large amounts of fluid either, we'll advocate for subcutaneous infusions because they're obviously spread out in smaller amounts that you would get over time. So yes, there is an improvement in that symptom profile in terms of the meningitis effect that you would see more with the IV.
Are essential oils okay to use with CVID?
I have not heard otherwise. And so I would say anything that, isn't used in excess or ingested. So I'm guessing this is applying essential oils, which should be fine. Unless I answered that, and that wasn't the question.
Thank you. Other than eating healthy, are there certain types of diets or foods that you recommend to help manage PI?
Not really. I think mostly I recommend against any drastic diets. So anything where you're cutting out food groups or limiting yourself drastically in protein or in carbs, I just don't find that those are very beneficial for our patients, especially when we're trying to build general immune blocks and then also have all the nutrients. So eating healthy means a lot of different things, and it means variety, and it means awareness and mindfulness in what you eat. It also is a commitment. So, once you've decided to eat that way, you really have to buy into it. You have to prepare ahead. You have to take the time to make sure that you're doing it, for the whole week, for instance, meal planning. And so I think that alone, just having that kind of mindset and that shift of making this a whole experience is the one thing I try and recommend to my patients.
This question has an insurance component to it. This person's health insurance changed a couple of years ago, and the individual has been without an immunologist. And her primary care doctor has referred her to specialists, but then they say this person is too complicated. She has seen, or this person has seen, former specialists at major research hospitals in California. Doctors have written letters to her insurance company advocating for her to be referred out to a major medical center, and nothing is happening. What advice would you give to somebody like this? I feel deflated and do not know what to do next. So from your point of view, what would you do? And from IDF's point of view, I'm thinking that I will forward this question to our patient advocate, but Dr. Dimitriades, what do you think?
Yeah, I would, that would have been my response actually, is that IDF actually has people in place for this specific issue. So I think that would be the most helpful thing. I would also see if there is, I'm sure you've already done this, of course, but if there are patient advocates within the insurance system that you can reach out to in order to make this statement about how you feel that, that you aren't being listened to in this sense, so that they have, documentation that within the system you have also addressed that with them, so that when the patient advocate through IDF gets involved, you have kind of this, you have taken every single avenue, in addition to physicians speaking for you, but also you speaking for yourself there, to try and get this addressed.
Thank you. Yeah. Oh my goodness, Dr. Dimitriades, you are simply amazing, and we cannot thank you enough for answering all these questions and your great presentation.
Thank you. I'm
Thank
sorry if I didn't understand quite what you guys were asking, but hopefully we got at least the beginning of some of those started. So.
Oh, no, it was amazing. So thank you so much. And if your question wasn't answered, don't worry. As long as your name is attached to the question that you submitted through the chat, we will be able to follow up with you. So thank you so much. And right now, I would like to invite Sean McCabe from Takeda for a quick word from our sponsor.
Hi, and wow, Dr. Dimitriades, that was the firing line of questions. I've never seen such a thing, and amazing. Obviously very relevant and apropos, so really appreciate the thoughtful responses and obviously support to the community. Phenomenal job. I just sat there in awe. I was like, how is she still doing it? So just Sean McCabe, I have the honor and the privilege of leading the Immunodeficiency franchise at Takeda. I'm joined tonight with my dear colleague, Dana Flathammer, who leads the community support team. If you know Takeda, relatively new name, but certainly not in terms of the therapies that we manufacture. Our lineage is Baxter, and we're the proud manufacturers of GammaGuard, HyQvia, and Cuvitru. But we're not here to talk products tonight. We're here to listen. We're here to engage with the community, and most importantly, answer any questions that may be relevant to what we can do to help support you. And then more importantly, the services that we also offer the community outside of product, brand, et cetera, with my IG source and Dana's advocates. So look forward to seeing everyone in the breakout. Phenomenal job. Again, Dr. Dimitriades, really appreciate the great support. And obviously, I'll just say it, I say it every time to the IDF, this team is absolutely phenomenal in standing up in the moment, being innovative, and supporting the community like nothing that we've seen thus far. So we're honored to be a part of it. Phenomenal job to the staff as always, and thank you very much.
Thank you, Sean. Now, before we head into our virtual exhibit hall, I would like to encourage everyone to please connect with IDF online, visit our website to access our many resources that we have to offer, such as publications, online support groups, updates on upcoming events, and so much more. And you can also connect with us via social media to keep up to date with our community. So once again, thank you. Thank you to all of our sponsors for today's forum. And at this point in time, I would just like to say thank you. Thank you to our presenter, to our sponsors, and to each of you for joining us tonight. And anything, anytime, let us know. Take care.